But one cool thing is that a lot of people don't know, and maybe you didn't know this, our babies are on caffeine.
What? Like, because their moms drink coffee all the time? Moms that just like pound the rock stars daily, and you're like, okay, this baby's gonna have withdrawals for sure.
Yeah, we make our babies little praline lattes.
Pumpkin spice right around now.
Pumpkin spice for the preemies. Caffeine for life. These babies are put on caffeine because it's a stimulant that helps against apnea. So we will give a baby IV or PO, oral caffeine, in order to help with their apnea spells.
Really?
Yeah, isn't that fun? I had a mom who had just come out of delivery and she was up visiting her baby in the NICU. And I said, oh, how's it going? How are you feeling? She's like, man, I am so tired. I even told my postpartum nurse that, man, give me some of that IV caffeine. The postpartum nurse started laughing and said, oh God, that's not a thing. And she goes, whatever, my baby's on it. Get up.
Oh my God.
And that cracked me up because I was like, well, it's true.
There's got to be some sort of negative effects to caffeine. If we're talking apnea, obviously you're gonna take that risk. It will help with breathing. If people will find that it'll help with their breathing. That makes sense. But no, I did not know that.
Obviously it's been fine-tuned and they find that perfect therapeutic dose. Yeah, they'll be on caffeine up for a few weeks until they can kind of get through. It makes them a little wound up. They'll be a little angsty, but for the most part, there aren't really major side effects.
So what other medications are you using besides caffeine? What are you using a lot of?
Well, just like you, in any unit really, you start to see the same medications over and over. Caffeine is a very regular one. A lot of times we'll have babies that need diuretics, so we'll have a lot of babies who are on sodium or potassium supplements in order to get those all in check. We'll do a lot of antibiotics if we know that there's a potential for a baby who has exposure to a bug, whether from mom or surgery or whatever, so we'll see a lot of that. But for the most part, we don't use a lot of different drugs. You'll just see a lot of the caffeine, the supplements, antibiotics, and then of course pain relievers. And breast milk is considered a drug.
Good one.
Yeah. We have to scan breast milk into our MAR just like anything else.
And this is a depressing topic, but healthcare isn't always rainbows and kittens. So a child's comes to neonatal ICU, everything's looking good, then all of a sudden everything starts looking bad. Or right off the bat, you know that this child's not going to make it, and they don't make it. What is kind of the process for the parents? I imagine they spend more time with the child and all that, but what is it like? I mean, because I have no idea what it's like to have a kid that's born and you know that they've got something going on with them that it's just not gonna work.
That's the amazing thing about our neonatologists, the level of compassion that they have with these families. You have to have a huge talk about where do you want to go? What's the direction you want? How do you want this to play out? When you're lucky, you have time to have these talks and make these decisions. Unfortunately, it's not always the case. Sometimes things happen sooner or more unexpected than we can ever account for. We have so many things that we do. We'll do little clay handprints. If the baby's got some hair, we'll cut off little locks of hair. We have little memory books. We take some really beautiful photos. There's volunteer photography services like Now I Lay Me Down to Sleep, a national volunteer association where they come and take pictures professionally.
That name just makes me so sad.
It is. It's a terrible thing that even has to exist.
Yeah. But I mean, that's the reality.
Yeah. And they'll come to your hospital. They'll take wonderful pictures of the family with the baby, and we'll do everything we can to preserve the memory of that child and get all these mementos and things that the parents can physically take with them. The family can spend as much time as they want to. We'll pretty much accommodate any request that the families have for these moments with their child. In the big picture, it can be very sweet. It's just very therapeutic for the family to have these moments. Those are the things that we try. And then we have great resources outside of the hospital and support groups and counseling. And it's really important to know that even though this baby's life is shorter than expected, it's still impactful.
I love babies. Even though it's hard for me to take care of them, I do love them. And I think a lot of nurses probably go into pediatrics because they love babies. And I try to think of it more as if you're able to handle being around sick babies or dying babies. What questions would you ask yourself if you were a nurse that was kind of thinking about what specialty you want to do and you think that, PICU or NICU is when you want to get into? I know we talked about math. If you don't like math, steer clear.
You have to really be okay with the whole family dynamic. So you have to be okay with dealing with anxious parents. So if you're cool with dealing with families, dealing with them as well as the medical needs of the kid, That's cool. I hear both sides of it. I hear a lot of people that go, oh, so you just cuddle babies for a living. And it's not quite that, but I also don't have to see sick and dying babies all the time either. There is really a nice balance about it. I have heard from some of my coworkers that once they had their own kids, it was very difficult for them to come to work and see sick babies. That's understandable. That's my reason why I can't do pediatrics. Because to me, seeing a 5 or 6 year old kid who's sick would just break my heart. I think it just really comes down to trying to find the positive in it and understand that any type of nursing is going to have its bad days. It's going to have its sad cases, its bad patients. The NICU in general is a super positive place. We get these babies, they're small, they're premature, they need some surgical help. We fix them, we get them bigger, we get them stronger, and we send them home. And that's the beauty of having such a young, vibrant population. When you can get them feeling better and send them home, it's the most encouraging, amazing feeling in the world, which makes those rare cases that don't go as well much easier to bear.
Say that they've thought about all those things, they've decided, I want to do NICU. How would you suggest they go about doing it? A lot of nursing instructors will say, you should first start out doing a Euro Med Surg before you start exploring other specialties and that kind of thing. I went right into the ER, I did a nursing residency and it was amazing. But at the same time, what do you think is the best route to take as far as a nurse who is either in nursing school, someone who's preparing themselves to actually head towards that direction of getting involved in the NICU?
My nurse manager, my original nurse manager, I think she set me up the best. Her thing was get to understand healthy moms and healthy babies. And once you understand what a healthy baby looks like, it'll make more sense for you to understand how to deal with a sick baby.
But you'll know what an unhealthy baby looks like right when you
exactly. And once you transition into the NICU, which can be a very crazy place, then you have that foundation and you know what it means to have a healthy baby and you know what it looks like when things deviate from that plan. I personally am very thankful for that advice. I wouldn't have taken that advice. I would have jumped right into what I wanted to do.
Which I think a lot of nurses are eager to do.
Yeah, you really get to understand those basic foundations of how to be a nurse. I think it really helps you branch into your specialty with a lot more strength and a lot more foresight.
So you think starting in postpartum unit?
I think starting out in a postpartum unit is a great way to go. Things like breastfeeding and stuff, you just don't learn those skills when you're in a NICU. Having strong skills in those types of areas, that really helps. I think it's really great to have a lot of your certifications done. An NRP certification for neonatal resuscitation is a great thing to have on board. I got that before I graduated nursing school.
Before you graduated nursing school, you can do that?
You can do that. It's absolutely something you can just do. And to have that and have that knowledge and to have that on your resume that, hey man, I'm prepared, I know what I want, I'm in it.
Not necessarily for a NICU job, but even for a postpartum job, for any job.
For any job. It's a good way to get a feel of what you're going into.
The NICU is just a world I don't encounter. And I imagine that a lot of nurses don't encounter it, but a lot of them want to pursue it. It's like you really have to be there to know what a day in a life is like.
I think shadowing is a great idea, or talking to people in the profession and just getting a feel of what it really is you're getting into. Because I think there's misconceptions about what labor and delivery or postpartum or NICU are like until you're really in it. I want to know how many diapers you've changed.
How many diapers I've changed? I have changed a fair amount of diapers. A lot of times we have to get urine samples on little babies when they come in, so we got to put the little U-bags on them. I'll try and get the parents to do it because usually the baby, responds better to them. But no, I've changed a fair amount of diapers. Adult diapers, 100%. Way too many adult diaper changes, but I couldn't give you a number.
No, sometimes it's like dressing a cat. You got to kind of...
Yeah. My least favorite thing to do with children in the ER, a lot of times we have to do the nasal washout. That's just kind of miserable, shoving them up their nose and having it come out the other end, and they're like, "Ah!"
Nobody would like that.
Yeah, it's like a full force neti pot on steroids going through your nose, and it's got to be the most uncomfortable feeling.
And probably just as uncomfortable for the parents.
Sometimes I'm like, yeah, you might want to step out of the room because this is going to look like barbaric for you. We're not going to do anything that's going to hurt them, but at the same time, you probably don't want this memory in your head.
It's like watching your son's circumcision. There's just some things that you just don't necessarily need to be there for.
Do people do that?
Watch it?
Yeah.
They ask, but no.
You don't encourage it. What else is interesting to the NICU that a lot of people don't know?
It's funny because people look at babies and they're like, oh, I just love babies. Babies are, what people forget, little tiny humans. Every little tiny human has a personality, just like a big human. And so sometimes you're totally connecting and feeling that baby, and sometimes you gotta work a little harder to find that connection. Just like you would with anybody you meet, Yeah, there are days where I'm totally in it, and there are days where I gotta work. It's funny because you don't always get along with with every baby you meet.
I've experienced that.
Sometimes you're like, all right, we're gonna agree to disagree, little buddy.
Well, we're waiting for the coffee. Are you the type that saves greeting cards, or do you just chuck them once you get them? And I'm sorry if this is, someone's gonna be like, she chucked my greeting card.
No, Aunt Millie, I would never. For Christmas and stuff, like I'll hang them up, and or like a birthday, I'll put them up on the counter. I'll display them for probably a solid month, and I'll appreciate them and have their moment. Like cards when my kid was born, I put those like in the baby book so they can look back and see who wrote them cards. Like annual things, I'll appreciate it for a hot minute, and then I'll send it on its way.
Okay. On a scale of 1 to 10. How about this? On a scale of 1 to Adele, how well can you sing?
Reality speaking,
Based on what you think and based on what reality is. Hello.
definitely no Adele.
Okay.
I'd say in the shower, I'm like a 5. After a few drinks, I'm like a 6. You put a karaoke mic in my hand, I'm gonna go ahead and say I'm a 7.
Is that after the drinks though?
Yes.
Okay.
Full shot, almond, no whip.
See, now that's why it was $7 though. You gotta pay more for the almond and more for your extra shot.
I don't know anything about coffee, clearly.
You wanna do a little singing? I have a very appropriate song for our topic.
Do you?
Yeah.
If you would like to go ahead.
Okay.
What song is it? I don't know what song this is.
This is a little Justin Bieber action.
I don't know this stuff.
You will when it comes to the chorus.
I went to a Bieber concert, you know that?
No way.
I did. I was up in the Super Suite. It was ridiculous. I loved it.
Good for you. Come on, you got me on this one. Baby, baby.
Yeah, there you go. Baby, 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 He actually did this song when I was there. One of his most
Should be
popular.
bringing back memories for you.
It wasn't the best concert, I'll tell you that much. He came out, and I'd never seen this response at all. He'd walk out on us, everything was pretty quiet, and he would just look. Every single girl in that section would scream at the top of their lungs. I was like, it made me realize how impressionable he was. Have you met any famous people?
Yes.
Who? What's the most famous person you've met?
Ray Liotta.
Really?
Yeah, I actually sat next to him right behind home plate at Dodger Stadium for like an entire baseball game. He sat
were you
right
just
next to
bugging
me.
him the whole time?
Yeah, we were just chit-chatting. I was probably 14. Oh, I had the biggest crush on him because he is just the nicest man.
Before or after?
Before and
Really?
after. But I met him. He is a beautiful human. Those eyes are just so baby blue. He always plays such in his movies, but he's such a nice guy.
So if there was a famous person that you could meet, haven't had the opportunity.
Oh, Chris Hemsworth.
Is that Thor? Okay, yeah, wow.
Makes my heart flutter.
Yeah, he's a stud.
He
I'm not
is
gonna
my
lie.
crush.
I don't know what he's like off camera.
He just seems like such a good family guy. He's my hall pass for sure.
It's he's one of those guys where it's like you just look at him and you're like, there's no way he can be upset in general
Ain't
about
that
anything.
beautiful?
When I say the word fun, what's the first thing that comes to mind?
A water slide just popped into my head.
Water slides are. Have you been to Wild Waves?
I have. I love that place.
My sister and I used to get season passes every year.
Yes.
As like grown ass adults. Favorite movie genre?
I'm a big comedy fan. I love sitting down and having a good laugh. Just like a little grandma's boy or
You're not gonna believe this, but whenever I give examples of comedy movies that I don't like, it's Grandma's Boy. Ask any one of my friends.
Oh, come on, the guy with the robot. That's so funny.
Oh my god, that depresses me.
Okay, agree to disagree.
I
Just
judge
slapstick
character a
humor,
lot
you know?
based on what kind of comedy someone likes. You just taken down a few notches. Let's see if we can bring them back up. What kind of music do you like besides Justin Bieber?
A little bit of everything. I honestly, that's always been a really hard question for me. I definitely have my
Reggae.
moments where I really want to get into like my Hawaiian reggae zone.
I learned to really like reggae when I was in Hawaii.
Some days when you want to go to the gym and you just want to kind of be angry, you want to listen to some good rock or feel like being a little happy and you want to listen to something like Bieber. I'm all over the place.
Yeah, I don't do the rock. I'll do some really savage rap if I want to do some good lifting. If I want to do some good running, I'll do some kind of hype electronic music.
If you looked through my phone right now, you would see all kinds of music. Like I'm all over the place.
Yeah. Do you stay up to date with the newest tunes, or do you just have like the same thing that's been in rotation?
Oh yeah, no, I am so up to date. See, that's the thing.
Really?
See, I'm a mom. Well, I gotta be the cool mom. Like I got expectations.
You don't have to
I strive.
So you're being the cool mom, you're in
Yes.
school to be a doctor.
You know, I want my kids to be proud of their
Yeah.
mom knowing the latest rap lyrics.
I don't think your kids are wanting that. That was like the last thing I wanted my mom to know was what the latest rap lyrics were.
I'm not judging, it's all good. I'm gonna listen to some Eminem with my kids in the car.
I don't know what that's like. I wanted my mom to be so separated from everything I did.
I think my kids enjoy it. I do. I think it's fun to kind of be in with the latest trends so that I can be on par with the jokes. Now, my two top stations on my Sirius radio are 80s and 90s. So I love a good
Okay.
old school
Yeah.
flashback type thing. But
Is there something you've eaten where you've been like, there's no way I'm never gonna eat that again?
if anything has made me feel that way, it's spicy food. I just can't do it. I don't know what my deal is. I can detect it. I'm like a human detector for any sort of spice in there. That's probably where I draw the line.
If you had one food to eat for the rest of your life,
I think about this. I'm like, if I'm on death row, like what would be my final thing?
are you planning to be on death row? Why is that circulating through your
a girl
head?
has to be prepared. I mean, give me some good old cheese enchiladas. I think I'm a big Mexican food
Cheese
fan.
enchiladas. Is that just cheese on tortilla?
With sauce.
My last name's
Enchiladas.
Torres. You'd think I'd know these things, but
What about you? What's your death row food?
it would have to be my dad's tofu stir fried. I've had it since I was a child, and it's my favorite meal. He makes like a gigantic pan of it. It's never enough.
You probably have memories associated with it too.
The only difference is I used to drench it in soy sauce because I didn't realize how much sodium is in soy sauce.
It is pure sodium.
It's in a tablespoon. It's a day's worth of what you're supposed to have. How do they get away with that? No one's gonna put a tablespoon on whatever they're eating. And even you get the low sodium soy sauce, people are like, oh, it's fine. It's not. It can taste okay sometimes, but the sodium's still off the charts. What makes you tick? What is the one thing that people do that you're just like, fuck, stop?
Hey, whoa, what's the deal with these drivers in Washington with this whole left-hand lane, I'm gonna drive slower than speed limit situation? Drives me bananas around here.
You have to learn to be an offensive driver.
I have a long commute to work when I decide to drive around. It's serious business when these people are side by side looking around like, get over. Let me go about my business. I got work to do here. It drives me absolutely insane. And I try to be a pretty chill driver, but they leave me no choice.
The one thing I do remember about drivers is the guy kept saying Washington. And not only that, he kept saying, license in Washington. And he started talking about when you wash the top of your car. Like, this guy's just looking for things to say in wash. What is the most mischievous thing that you've ever done?
Am I allowed to say this?
You're allowed to say this. Just be prepared.
Oh man, I really have to think about this because it's been...
You think about that while I'm asking
I'm not
you.
prepared for that one.
Oh
We
my
live in
goodness.
Washington. Why is the sun out?
All of my years of tanning have prepared me for this moment. What do you consider yourself a natural at?
I am actually a world champion.
World champion at what? You just say you're a world champion.
I won a gold medal at the World Championships of Outrigger Canoe Paddling in Australia in 2000. Also, I won a gold and a bronze actually down there. So it's kind of a fun little tidbit about me, but back in my heyday.
Were you a natural at it, or would
Yeah, I started paddling when I was 10 and I just picked it up. It was a great sport for me and it got me out on the water in Hawaii and I loved it.
I wanted to get on doing some canoeing when I was out in Hawaii, but never got around to it. I was too busy lounging at the beach, living life, one moment at a time. I didn't have to get out of there, and eventually I want to go back. I would love to go back. However, I was not doing shit productivity-wise. I was doing my job. I was going to work. I was, being a nurse. But as far as having any sort of creative outlet or anything like that, they say you're supposed to live in the moment, be very present, and I felt like that's what I was doing, and I was just kind of taking life as it came. I just can't do that. Like, I need to be working on something.
You were on like permanent vacation mode out there.
Exactly.
Yeah.
It was an amazing time, but I definitely, when I went down to Peru and did some soul searching and ultimately came back here and I was like, I got to start doing something that's more than what I'm doing now. Nursing's very rewarding, but at the same time, you can get burnt out and you can get a little bit bored of what you're doing. Because, when you're in school, you're like so psyched to do, once I become a registered nurse, it's going to be so awesome. And then you're like, oh my God, this is driving me nuts. A lot of emotional stress that comes along with it. And there's a lot of emotional stress that comes along with getting into trouble. What is the most mischievous thing that you've ever done? It doesn't have to be like, incriminating.
I do mischievous things all the time, so I'm trying to think if one particular thing stands out.
How many hours a week do you spend time watching television? Netflix, anything like that?
Way more than I should. And now that I've discovered download option on Netflix where I can now watch things when I'm not on Wi-Fi, I have a little screen time. I catch up on my shows when I'm getting ready for work, blow drying my hair, or when I'm commuting.
So it's not like engaged watching?
So I can't watch any like serious dramas, usually like sitcoms or something kind of light. I binge watch a lot of shows.
What are those shows?
I'm binge watching all of It's Always Sunny in Philadelphia right now.
There's 2 comedies. When it comes to movie comedies, it's Grandma's Boy. When it comes to television, it's Always Sunny. So many people love them. It's got to be something to them.
There's a taste for everybody out there. It's such like, you don't even have to think about it. I get a kick out of how those guys just degrade each other. Okay, what about The Office?
The Office is my favorite show of all time.
Okay, well thank you. That is my favorite comedy. That's a classic. It's so good.
Gaining points.
All right, redeeming myself.
I
I went to trivia night where it was Office themed. Everybody was so on it with their Office trivia. I mean, that show has such a wide breadth of fans.
I've always been good at memorizing things like rap lyrics. I honestly think that 2 things I keep in my brain: rap lyrics, medical knowledge. That's it. And then Office quotes.
So with this like crazy amount of rap lyric knowledge that you have, if you're to like go to karaoke, is that what you would?
I'd kill it on I'd kill it on pretty much most rap songs.
Okay, here's your moment. What would you pick?
I would say you choose for me.
What about a little Dr. Dre action?
All day.
All
Dr.
day.
Dre. Honestly.
See, my go-to is Shoop. I'm a salt and pepper fanatic.
Okay, but I mean, who doesn't know Shoop? There's so many songs that I could just go from beginning to end and not miss a single syllable. I impress myself sometimes. I'm like, damn, I'm fucking good. What do you think your strongest sense is?
I normally wear glasses, so I don't know that my eyesight is so great.
Nope.
I guess you could say I'm pretty in tune with my touch, and I think as a NICU nurse, I gotta kind of be kind of good with that. A lot of my job has to do with therapeutic touch and massage for these babies. And
how many times a day do you look at yourself in the mirror?
Not enough, actually. I'll go through like a 12-hour shift at work, and then I'll finally like take a peek in the mirror after I'm washing my hands, and I'm like, wow, that is a giant situation on my face. Or no, my hair's sticking out. Nobody told me that. That's cute. That's great. I'm not a big selfie person. I'm not big.
Not very big.
Like, I like to look nice, but it's not my world.
Gotcha.
Yeah. Nowadays the selfie culture, it's a real thing.
This new iPhone thing, they say the front-facing camera does the skin smoothing thing.
Everybody can look like a baby again.
My nephew, whenever I play, I'd be like, dude, your skin is like so fresh.
What's crazy with preemies though is that they're actually born without all their little fat deposits.
Mm-hmm.
So they're actually born looking like little old men.
Yeah.
They go through little wrinkly foreheads or little wrinkly elbows, and then they plump up a little, then they look more like babies. But it's but they look like little old men when they're first born.
So what's the earliest preemie that you've seen?
So years ago, they would never really do anything past 24 weeks. And 24 weeks was like the point of viability.
24 weeks premature out of a 40-week pregnancy.
24 weeks, yep, gestational age, when 40 weeks is term. Yeah, you're talking, a solid 4 months early before your due date. Now they've started pushing it back, and I've seen babies as early as 23 weeks where they've done okay. I've seen them push it back even further. Sometimes they're starting to kind of eke into the 22. Science is pretty amazing, the things that they can do. I'm not sure how much further back you can really get. It's come a long way. It's pretty impressive.
First off, what's your favorite soft drink?
I'm gonna go with cherry Dr. Pepper.
Our healthcare system's out of whack. People are just not healthy in general. And this doesn't have to be health advice, but if you had the opportunity to say one thing to the entire world, what would it be?
Preventative maintenance. We're all these well-oiled machines, and we need to keep up with our care. We need to get vaccinations. We need to have well checks. We need to keep an eye on our own health, be our own best advocates. I just think preventative health is super important.
I think that's the direction that a lot of hospitals are going, and that's the way that healthcare is going. I mean, kind of why I'm doing what I'm doing, because people got to start learning how to take care of themselves so they don't end up in the hospital, and they're like, holy shit, I've been doing something wrong for 30 years. It's like, yo, I get it. No one told you.
You got to see the doctor to get that information.
Yeah, exactly. You got to see the doctor, but not a lot of people do that. Most people are spending time on YouTube, so guess what? I'm gonna find them on YouTube. That's how it's going down.
It's a lot easier to oil the wheels than it is to try to replace the whole machines.